Let's have a chat. Right. So emergency medicine workforce in Ireland, 2024 to 2038, that is the new plan. Initially, they had really less posts for emergency medicine, non-training and training. Now they have started this. Okay, since 2024, they have been consistently increasing their workforce in EM, and they are actively looking for more people. So the summary of this target is that Ireland has fewer EM consultants per capita than international peers, over-reliance on non-training scheme doctors, and training pipeline is insufficient for future demand. Their target for 2038 is 335 WTE consultants, that is work time based or full-time consultant, that's what they call it, need nationally, 80% increase from current workforce, alignment with international standards. The solution to this is that they need to expand their training programs significantly, recruit about 50 to 55 international consultants, and convert non-training posts to training posts because they need trained people. Okay. The current workforce baseline is that they've got 182 full-time consultants. Okay. 22.2% over the age of 55. So they are nearing retirement, basically. You've got 540 non-training scheme doctors, and then you've got 148 trainees who are either in the CSTEM or the advanced one. Okay, so either core or the advanced, right? Combined, that's very less. Their workforce has 68% male and 32% females, 84% work full time. And so additionally, they do need a lot of people. All right. So this is a comparison of what's been happening. Okay. So if you have a look internationally, Ireland has really less consultants than it's England. Then look at Scotland. Scotland's really good. Then you've got Wales, and then that you've got New Zealand. Okay. So New Zealand has the best consultants per 100,000 people, right? And if you look at non-trainees, Ireland has the most. Oh, well, next to England. No, Ireland still has the most. And then England has a lot of trainees, but they don't have a lot of consultants. That's what they're looking for. All right. So what's the model here for emergency medicine? Now, the model is important because that is how they conduct interviews. You need to understand their system to get into their system. So please pay attention. Pillar one is organization. So networks of emergency care, they've got pre-hospital EM integration, they've got pediatric specialization, and then they've got geriatric care focus as well. They've got these three classes. Pillar two is the patient pathway. So you have your key specialty interfaces where we know which pathway to follow. So if it's chest pain, there's a separate pathway, and so on. Streamlined care processes, improved patient flow, and reduced waiting time. So they are also coming to the 4-hour wait period as well in the ER, just like England. Pillar three is infrastructure. So they are involving multidisciplinary teams, academic EM development, health information system, and physical infrastructure. And then fourth is values and measures. So they are going to work on value-based emergency care, systems improvement approach, clinical guidelines are going to get better, and then green emergency care, which is basically less waste. Training program structure. Sorry, is there a question? Sorry. Can I just ask everybody to go mute, please? Thank you. Okay, so let's come to the training program structure. Internia, that is your foundation medical training. Then you have your CSTEM, which is your core specialist training in emergency medicine, which is 3 years. And by the end of these 3 years, you complete your MRChem. Okay, you have to complete all 3 parts of your MRChem. And then you have your advanced specialty training, which is 4 years. And by the end of it, you complete your FRCEM. Okay. You have your CSTST award. If you've already done your MRChem, you can actually apply straight away into the ASTM for 4 years of advanced training. And then you get your certificate of successful completion of specialty training. Fellowship is optional. And then you are able to apply for the consultant post. Now, remember, in Ireland, only 48% of your core specialty training continue to advanced ones. Okay? 30% just move to some other specialty, and 22% just don't want further training. They're just too tired, I suppose. All right, so these are the numbers if you have a look. Year one, approved intake 30, 30, 30, and these are the current numbers. First year, 30, second year, 27. These are dropouts, basically. And year three, the 26. And if you look at the advanced specialty care, again, the approved posts were 18, 16, 14, 14, and this is how they were going. Graphic distribution is not that important. We'll skip that. Demand, again, this is why the demand is increasing because they have an aging population and so many non-training doctors, and many of their consultants are now reaching the age of retirement. Future demand projections are obviously they're going to increase the training posts for emergency medicine. Okay. This is not important. This is another subspecialty that you can consider after your training. So PEM consultants can train through either pediatric pathway or emergency medicine pathway. Okay, you can come from either or, requiring the post core specialty training fellowship for this one. So let's have a look at the important parts. I'm going to skip these because these are not important. International recruitment strategy. If you have a look at this, their plan is to increase this, okay? Currently, we are here. By 2026, they're going to have an exponential increase. And so they are looking for consultants, okay? And if you look at the consultant requirement, when I mentioned the hospitals, Dublin, Northeast, and Midlands, right? They have a good vacancy if you look. If you are interested in applying, by the way. All right. Now, the implementation timeline is not important. Neither is this. Now, let's go into the training part of it. The emergency medicine training has two phases, like we discussed. 3 years of core training and then 4 years of advanced specialty training. The first 3 years, this is what you're going to do. You have your induction process. The first year, you do 12 months with 6 months in emergency medicine, 6 months in TNO, plastics, or acute medicine. Then you've got second year you go through 6 months of EM and then 6 months of PEDS. And then the third year is 12 months where you've got 6 months of EM and then 6 months of anesthesia and critical care. Okay, this pathway is exactly the same as your UK training, by the way. This is exactly how your UK EM training goes. Then you have to give your exams. So you have your FRCEM and MRChem exams. By the end of your system, you have to give all 3 parts of your MRChem. And by the end of your ASTEM, you have to give your FRCEM. Department-wise, there's a balance. You can actually choose your rotations, which one you want to go first. But usually they do stay standard. You do have to complete 6 months minimum in many of these rotations. These are your resources which you can use. So EM Now is a network where you can get your updated Irish guidelines. You have your national clinical program. These are important for your interviews. So these are what you need to read. You have your RCEM guidelines and you have your Irish Association of Emergency Medicine. All of these are based on your RCEM guidelines. So if you know the RCEM guidelines, you're good. Now let's look at our CSTEM. There's nothing here. Yes. So this is what's important. The last year start date for CSTEM was July. This year, they haven't opened, and these are the training hospitals that do the training. So Dublin Hospital, regional hospital, you've got Cork, Galloway, Limerick, and Sligo. Specialist centers, these are the PEM centers where you can do peds emergency medicine, and these are the centers that provide that. So these are the hospitals. If you are looking for emergency medicine, non-trainee jobs even, these are the hospitals where you should apply. Okay. because they will then allow you to actually train with the trainees, and then you can further go into training. And even if you don't want to go into training, you can stay non-trainee, but you will be working with consultants who actually train EM trainees. So that helps. The training pathway overview, we've already covered this. So these are your rotations, year 1, year 2, year 3. We've already covered this. I'm just going quickly so as not to bore you guys. This is your appraisal process. Again, 6 months appraisal. 6 months appraisal is carried out by your supervisor, and then you have the annual one as well. And every 6 months, they have a discussion about what are your weaknesses, what are you good at, what's left, how are you preparing for exam, what more do you need for your portfolio, okay? And then you can actually progress to advanced training once you have done. These are your requirements. So MRChem primary, SBA, and OSCE. This is what you need for your core specialty training completion, all right? All 3 are required. If you have done your MRChem, you can apply for advanced training in emergency medicine, okay? Now, how to apply? Applications haven't opened yet. Keep a look on the website. CSTEM 2026 intake isn't open yet. Applications for core specialty training 2026 will open on the 15th of October and close on 14th of November, okay? All interviews will take place in person. So the emergency medicine interviews take place in person, all right, in February 2026. Further information you can find on the website. We will share the link with you. This is your eligibility criteria. So you have to fill in the form. You should be eligible for registration. You should have a valid English exam result and be able to communicate. So yeah, these are the only things you need. Then let's go on to your advanced specialty training. Let me just have a look at the chat box before we go here. Next data. Okay, thank you.
बैठ जाएगा ऐसा नहीं
Okay, let's go to advanced specialty training. So for advanced specialty training, eligibility is emergency medicine experience. You need a minimum of 18 months in emergency medicine in Ireland, UK, South Africa, or Australia. Okay, so if you have that experience, if you have this much experience in these countries, you can apply. Anesthesia or intensive care, so minimum 6 months or evidence of achieving core specialty training, competencies through workplace assessment. So if you have that signed off, good enough. Minimum 6 months in peds emergency medicine or acute pediatrics, you have to have that signed off. Additional experience is 12 to 18 months in emergency medicine or relevant specialties. Now, this can be anywhere. Okay, this is not specifically for UK, Ireland. Okay, all experiences must be within the 5 years of your application. So anything older is not going to count. Keep that in mind. Outside these countries is not going to be accepted, unfortunately. That is what their requirement is. So this is your pathway, specialist registrar status. So you will be put on the specialist registrar status when you enter this training system. You have your multi-center rotations, then you have your pediatric placement, and then you have your final assessment before you get your CCT. Again, the same process applies: appraisal, FRCEM completion, and then an exit interview, basically. Certificate and registration, you will be able to register for the Irish Committee of Emergency Medicine Training. And so if you cannot find emergency medicine training, it is with the Surgical Council, by the way. So your Ireland Surgical Specialty Training has the website under which you can find emergency medicine training. That's where this is. Passing the FRCEM is mandatory before being eligible for inclusion on the register of medical specialists, by the way. So if you haven't passed your FRCEM yet, after your ASTEM, you do need to pass it before you can be awarded with your completion of training. There's nothing major here. So yeah, that is about it. If you're already working in UK, already working in Ireland, this is another option that you can look into for your emergency medicine journey for a CCT if you want to work towards a CCT and you haven't gotten a training because they are very similar in pathways, okay? And in the UK, they are kind of transitioning out of chronic medical officers or non-training doctors. So you need to look into training at some point. You cannot be a non-training medical officer anymore. Ireland is doing the same thing. So if you are working in these countries, your aim should be to move into training as soon as possible eventually, because that is where the tide is turning in the coming years. Okay. Previously it wasn't like that. So I wouldn't have recommended it. And you can stay on training, good enough, complete your exams, and that's okay. But now the tide is shifting. They are moving towards these things. So please, if it is possible for you, start looking into training as earlier as possible. Yes, it's a long journey. Yes, it's difficult. Yes, it's not built for everybody. But if you are looking for a long-term stay in these countries, then you have to look into these kind of trainings. Don't just take this for granted. Don't just say, okay, non-training job, good enough. I'm happy. That's not going to be enough in the coming years, especially since the UK has increased the ILR limit to 10 years, and it's going to start applying to the next, I think, in the upcoming years. So yeah, that's going to make things difficult for people if they're just, targeting a non-training job. Okay. That is the end of my presentation. Thank you all for listening and bearing with me. If you have questions now about anything else regarding Ireland that I might have missed or you want me to cover in the future, just ask away. Otherwise, I think that the Ireland chapter is closed with regards to all types of specialty training. Any question? Sorry, I missed the part when, wait, what? I mean, how much experience accept these countries? 12 to 18 months. That's what you need. And that's roughly what you need for MRChem SPA anyway. Sorry, I missed the part when portal will open for Ireland training. Ireland training, which specialty are you asking? If it's emergency medicine, the core training is going to open by end October or November. Let me just go back and show you. So it is October. Let me show you the dates. The advanced one you don't apply for, by the way, because you need the training. You need experience in Ireland or UK. But this is the one. So these are the dates. 15th of October is when they open and close on 14th of November. But the interview process is in person. Okay, so emergency medicine process in person. For the basic specialty training, it's going to be online. Oh, sorry. So I'm just going to keep this up for all of you to see. Anyway, okay. Any other questions? My question is, without active IMC, you can still apply. Before your part B is when you need, so application B is when you need to, listen, you can apply for training if you meet the criteria. Okay. For EM, I don't think there is an SJT exam. You don't need to do that. For basic specialty training is when you have the BST and all of them. So for emergency medicine, before your interviews or before your application close, you should have your active one. But I will still double check. I think for basic specialty training, they have given the leeway where you can apply to phase 2, which is the interview phase, and you should have active IMC before you start the job. So that is January. For EM, the job is going to be a bit later, March, April. So preferably, I think IMC is going to give you that leeway that you can have a active registration by the job starts. As long as you've submitted and given all your documents and paid, you should be good. But they do have a free webinar, which is coming up. So attend that to get more information. I'll see if I can get more information on this one as well. Such detail now presented. Have to get, oh, thank you so much, Guzman. Is it really worth now to take MRChem exam considering it's taking such a long time to find OSCE? So that's the thing. This is why we did the Ireland webinar. If you've done your SBA, you are waiting for your OSCE seat, right? Apply for IMC, get your non-training job in the meanwhile. You need 2.5 experience, 12 to 18 months of experience for your advanced, okay? So this is me giving you a career tip, if you will. Those who want to take it, take it. Now, if you haven't gotten your OSCE seat, my advice, get a job in Ireland. You will be on the priority list. Give your OSCE. In the meanwhile, work in Ireland as a non-training doctor for 12 to 18 months. Finish your MRChem OSCE. Now you are eligible for the advanced specialty training. Apply for that. You don't need any other exams. You just go straight into your advanced specialty training. You get a CCT and you get FRCEM. So you can't go wrong. If this is your job, if it's your pathway of EM. If you're doing MRChem as a shortcut and you want to pursue some other specialty, then no, this is not worth it. But if ER is where you see yourself in the next 10, 12 years, yes, it is worth it. If you see yourself doing GP or something else, then I would say apply for GP training. Why waste money on MRChem exams? Just do that instead. Don't waste your time. Thank you everybody for your lovely comments. With MRChem primary and SBA, you can get registrar job easily. Yeah, that's true. I have many people who have gotten this job, and that's why I'm saying. So I think the major problem when it comes to career guidance in Pakistan specifically is that we tend to follow our seniors, and whatever they did, we feel like, okay, that's what we're supposed to do. We don't look for other options. And because we don't look for other options, when they fail in their pathway, we just like sitting there, okay, so he couldn't do it. That's why nobody can do it. No, that's not true. There are exceptions to the rule, and each and every one of you can be an exception, okay? Do not just give up that easily. Yes, it requires hard work. Yes, you will have to give interviews if you haven't ever given interviews in your life. If you've never filled an application form, well, good luck, but now you will have to. And nobody's going to offer you a job, in a neat parcel with a bow on top asking for, your services in their hospital. That's not how the world works. And that could be a reality check for many of you. But anybody who puts in the work, if you work hard, if you put in that effort for your application, your CV, your interview, you have a solid portfolio, nobody's going to say no to you. Okay. Nobody wants to say no to a good doctor ever. So keep that in mind. Okay. People get jobs. Just because you hear about the failures doesn't mean there aren't any success stories. Many people just don't publish their success stories. That's just how it is. Thank you, everybody else. I have active IMC with SBA cleared, still no interview. Like I said, Osman, work hard. That's all the advice I can give you. Also, I am in the process of getting things together for the workshops for interview and CV. And so far, a lot of you, by the way, after the first session, sent me their CVs, and my WhatsApp was choked for a day. And I do apologize to anybody that I haven't replied to yet. The thing is, it's very difficult to go through everybody's CV. Okay. I'm just going to give you some of the tips I did give in the first video that's been uploaded on YouTube, by the way. Just there's a short segment. I haven't time marked it, so you might have to go through the video to see it. However, I'm going to give you some quick tips This isn't CV related, but just to know your CV, anybody who's looking at your CV has to give your CV 6 to 10 seconds. Okay. Now, in that 6 to 10 seconds, look at your CV for 6 to 10 seconds. What stands out? If nothing stands out, there's a problem with your CV. Okay. If there's something that stands out that you don't want to stand out, or you think that's not going to get in your job, then get rid of it. Things should stand out that you think are important, that the recruiter is going to be like, okay, 2 years emergency medicine, MR Chem done. Okay, brilliant. I need this person. For 6 to 10 seconds. And do this exercise with people around you because you might be biased. Okay, give it to your father, give it to your brother. 6 seconds. Get them to see what they see. And then tailor your CV according to this. Okay. And you will realize why you're not getting shortlisted. I hope that helps. We start webinar for application form and interview webinar that should be paid. We will try to do all of this. Like I said, I am looking for December. Give me time. We need to work. There's a lot of homework that goes behind these webinars, so we do need a bit of time before we can get this accurate information to you. And that is why we can only do these webinars like, once a month or maybe twice a month. We can. So yes, they are coming. Stay with us and we will do this. And thank you all for listening.